Hi, my name is Saunders, and I'm here to talk about combining and comparing metrics, specifically with a study that is involving the comparison of genetic markers in radiomic imagery in cancer diagnoses. So there are some benefits to combining and comparing different metric values. Often data being investigated for a project can be individualistic in nature, and this is a consequence of using data that depends on a user's experience, such as task completion time, average task time over multiple tasks, things like that. So it can be very useful to find a means to standardize the data across multiple users, as this can help not only identify possible problem areas to be solved, but also potentially provide new solutions to problems that may not have occurred when looking at the data at the individual level. This will help, again, identify the overall usability of the project itself, and this can be through the combination of different metrics into a specific usability score, or comparing against existing data from other results or experts that from work that has been done previously. Metrics themselves do not have to be inherently independent qualities, and it often can be beneficial to compare the data collected against the goals provided by other research and experts. Those new ways to analyze the data can be found, and so it does behoove project designers to investigate works from before. One such area of research that truly does benefit from combining and comparing metrics is that of cancer treatment. In the study explored in this paper, the authors were Lugalo, Damiel, Morris, and Pinker, present a potentially much more cost-effective alternative to genetic testing through their comparison of genetic markers against radiomic data. They use the term radiogenomic for this newest iteration of cancer research. Right now, personalized medicine is at the forefront of cancer diagnosis and treatment. A lot of the times, population-based medicine is not always useful at an individual level. You can find trends that show positive correlation in terms of cancer therapies, but due to the inherent individualistic nature of cancer as a disease, tailoring cancer therapy to the individual will always provide a more effective treatment plan. That having been said, right now the best means to treat cancer, genetic testing to identify the possible reactions to therapy as well as metastasis rates, can be very expensive, very time consuming, and very invasive on the patient level. And this will definitely prohibit access to this treatment plan for a lot of people, as not everyone will have the time, money, or in some cases, the necessary health to survive an invasive procedure. So the authors then chose to use radiogenomic options. These are the correlation between identified and known genetic markers for different cancers against radiomic imagery, such as MR, magnetic resonance imagery, to show as a sort of quicker, more cost-effective, and much less invasive means of doing genetic testing. We take the known data from two different fields, two different data acquisition techniques, and compare them in order to determine a effective path forward for the usability of the project as a whole. For this study, the authors used the analysis of many different types of cancers through different techniques such as box and whisker plots, heat correlation mapping, linear regression analysis, and they did this over the course of many different types of cancers, with a focus on brain, breast, gynecological, liver, kidney, and prostate cancers. Things that were investigated were the size of tumors, positions, growth rates, cancer score, correlated factors, which are individual metrics related specifically to genetic testing of cancers, and other such measurements that are known values from previous studies that they are applying to MR imaging as a whole for individual patients. So as an example of one such cancer analysis, we have a computer segmented model in the case of two different types of tumors, an estrogen receptor positive tumor on A and an estrogen receptor negative tumor in B, which have been segmented to show along with the computer extracted imaging phenotype values in ranges for different size, irregularity, and contrast, enhancement, heterogeneity, which is basically means the similarities between genetic samples. So with this particular data, they start to show a correlation between two different tumors that, while being genetically distinct, specifically in terms of their receptiveness to estrogen treatment plans, have size correlations that they're able to utilize to determine an individualistic path forward with regards to genetic markers themselves. Now, in this particular case, they're not comparing the two tumors here with each other so much as showing that this is an effective means to treat both types of tumors should either case arise in a real-world environment. Another means of data analysis used by the authors was the best fit linear regression model. And here they're differentiating features on three different tumors using what's called an econotype DX reoccurrence score, or ODXRS, which is here's three different sagittal T1 weighted fat suppressed post-contrast MRIs of the different tumors. These are specifically invasive ductal nuclear grade 1 carcinomas that have a ODXRS score of 10, as well as the corresponding corresponding kurtosis histogram. So as you can see, there is background data already being acquired, and this is not so much to show the comparison between these three different tumors so much as to show that there is a correlation between the size and of the tumor with genetic markers. There are known quantities in these tumors, the known genetic data of these tumors, and then they can start to show that there is correlation with the size found through MRI investigation methods, showing that yes, there is a potential to correlate between the two, allowing a further diagnosis that would not necessarily need a specific genetic test on the individual. You start to correlate this data, you can start to find a possible means to develop an individual level cancer therapy. Again, emphasizing their correlation of data across the different genetic markers versus MRI image-based phenotypes, we have this correlation heat map, which is based on single variable linear regression analysis between many different MR imaging phenotypes and the reoccurrence predictive models of what are Mammoprint, Econotype DX, PAM50 ROR-S, and PAM50 RO-P, which those four values on the y-axis to the left side are specific genetic investigative techniques to find unique genetic signatures that are found in these different types of cancers. Along the base of the graph, along the x-axis, we have size, shape, morphology, enhancement texture, kinetic curve assessment, and other kinetics, which are the SGMTKEs you see that help to show a correlation in the data between those recurrence scores, which are the genetic risks of that a type of cancer will appear or reoccur, with the image-based analyses that are performed through MRI scanning. As you can see with the heat map, there are some correlations, as yellow indicates a higher correlation compared to the blue, specifically with size and somewhat with shape of the tumors themselves, as opposed to textures and curvature and things like that. You can start to see that there are genetic correlations with the physical characteristics, of a tumor. While this would seem obvious because the genetic makeup of anything helps determine its physical characteristics, the application of which is a relatively new aspect of cancer diagnosis. Once we start to see a similarity between a specific size with a specific tumor, we can start to help identify much sooner what the particular cancer is, which would help to determine the possible treatment path forward. One other aspect used is these box and whisker plots, which help show a relationship of the MRI-based phenotypes of size, aka also in this case effective diameter, and the enhancement texture, which is against those different predictor models of MammaPrint, Onconotype DX, PAM50 RORS, and PAM50 RORP. As you can see, there is a greater variance with the texture correlation than there is with diameter, and it shows that that diameter, aka the effective size of a tumor, may have a very good correlation with the genetic predictors for cancer treatment. This can help with cancer itself. So there were some challenges that had been identified in this study. For one, correlated imagery may not always be the most accurate. Individuals can have very different reactions to therapy when going through a post-cancer diagnosis. Someone may react to chemotherapy in a way that another person doesn't. The other aspect of the correlated imagery data is that all these studies that they were being performed by the authors are retrospective in nature, which does have an inherent bias of pulling data from essentially secondary sources. The authors themselves aren't collecting this data directly from patients in their own course of study so much as they are correlating the data from other studies. This can mean that any errors that were present in the original studies would be errors that are present in this study. The authors instead proposed to use their study as a pilot. Here is a means that we have identified as possibly serve as an avenue of exploration. So they proposed that to reduce any challenges or errors that may arise from the study, that instead more robust studies in terms of population size can be used to help reduce statistical noise. But that having been said, there is a correlation that has been observable by the authors between the genetic markers and imagery, most profoundly in the size of the tumors that were investigated. This can show that combining different metrics does allow a more cost-effective treatment option. As this correlates to engineering project development, metrics themselves, by finding the relations between two different metrics, can help increase the effectiveness of the usability of a project. It does show that the feasibility of investigating not only the data previously identified in other works, but also combining the data that you have available to you to find a new method of determining the overall usability of a system. So thank you for your time, and I appreciate you. Have a good day.